Hi, this is Kayla Baroka, and my project is on enhancing operating room safety and efficiency through IV pump data interrogation into the electronic medical record. Manual IV programming contributes significantly to medication errors, documentation delays, and provider fatigue. According to Joseph and colleagues, IV medications make up 56% of all medication errors, and these errors are twice as likely to cause harm compared to non-IV medications. In the operating room, the environment is high acuity and full of distractions. Without system interrogation, providers have to manually document IV infusions while multitasking. This often leads to delayed charting, which reduces accuracy and can even result in overriding safety features. The purpose of this project is to implement smart IV pump and EMR interoperability. This interrogation will automate data entry, reduce errors, and improve patient safety. Evidence shows that IV pump and EMR interoperability significantly improves safety, documentation, and workflow efficiency. Joseph and colleagues found that in critical care settings, interoperability reduced IV medication programming errors by over 50%. Similarly, Van Horn and colleagues reported that in pediatric hospitals, interrogation reduced infusion-related errors, improving patient outcomes. Beyond safety, interoperability enhances documentation accuracy. According to Bartos and colleagues, after interrogation, there was 86% fewer manual keystrokes and a 75% increase in accurate documentation of infusion rate changes, providing more reliable data for real-time clinical decision-making. It also reduces clinical workload and boosts efficiency. Raghavan and colleagues found that real-time infusion documentation in the OR lessened provider burden and enables more timely interventions. And Giuliano and colleagues also showed that nurses saved 4 to 6 minutes per medication administration, giving them more time for direct patient care. Smart pump EMR interoperability also plays a major role in preventing medication errors. Biltoff and Finman found that after interrogation, there were fewer alert overrides, higher compliance with drug safety protocols, and a greater standardization across departments, all contributing to safer medication administration. It also supports cost savings. Way and colleagues report that a community hospital saved over $400,000 per year through reduced medication errors and more streamlined workflows. The implication for nurses and advanced practice nurses are significant with smart pump EMR interoperability. This technology enables real-time bidirectional data exchange between infusion pumps and the electronic medical record. For nurses, this means less time spent on manual data entry and fewer opportunities for documentation errors or workflow disruptions. It also enhances patient safety by ensuring real-time accuracy in infusion documentation and medication delivery. At the same time, it improves situational awareness, allowing nurses and APRNs to continuously monitor infusion status and patient responses without switching between systems. By providing accurate, real-time data, the interrogation enhances clinical decision-making, helps clinicians respond quickly and confidently to changes in a patient's condition. Finally, this interoperability promotes standardization of care, ensuring consistency in medication management practices across units and providers. When assessing the financial implications for an organization, both the initial investment and long-term return must be considered. Upfront costs include purchasing compatible smart infusion pumps such as Alaris or Baxter, implementing middleware for HL7 FHIR data exchange with EMRs like Epic at Yale, training clinical and IT staff, and upgrading infrastructure for secure real-time data flow. Although these costs are significant, long-term benefits outweigh them. Studies show major reductions in manual programming errors and related adverse drug events. They also show improved work efficiency and documentation accuracy. As mentioned before, annual savings exceeded $400,000 through fewer medication errors and streamlined processes. Automation minimizes chart corrections and administrative rework while improving staff satisfaction by reducing redundant tasks and allowing more direct patient care. Real-time documentation enhances medication safety, compliance, and accountability during high-stress situations. While training and adaptation require effort, they lead to lasting improvements in safety and efficiency. APRNs are ideally positioned to guide these implementations, strengthening their roles in informatics and quality improvement. In summary, Smart Pump EMR interoperability offers clear benefits in real-time documentation, workflow efficiency, and medication safety. Although further research is needed to understand its long-term effects on perioperative outcomes and staff workload, current evidence is highly encouraging. For anesthesia providers, a well-designed interface supports rapid, accurate decision-making in high-pressure environments. Looking ahead, interrogating artificial intelligence can introduce predictive alerts and enhance decision support, further improving safety and efficiency. Overall, the technology promotes safer, more standardized medication delivery, gives clinicians more time for direct patient care, and represents an important step towards safer, more efficient, and reliable care in high-acuity settings. These are my references.